Imagine your kidneys as tiny, tireless water filters, working 24/7 like overworked factory workers. Now picture dumping more water on them than they can handle, again and again, and then telling them to stop. They strain, they sweat, they try to keep everything running perfectly. Sounds stressful, right? Well, what seems harmless, holding your pee, can silently turn your kidneys against you. And the scary part? Most people have no idea what's happening inside their bodies. Think about it for a second. How many times have you ignored the urge to go? Maybe you were trapped in a long meeting, stuck in traffic, or binge watching a show late into the night. Just a few minutes, you tell yourself. No big deal. But here's the thing. Every time you hold it, your kidneys, those bean-shaped organs behind your ribs, are quietly overworking. They filter your blood, remove waste, balance electrolytes, and even help regulate your blood pressure. Think of them as your body's personal cleanup crew. And when that crew gets stressed, it's not just your bladder that suffers. You feel it across your whole body, often without noticing. Now let's break down what actually happens, minute by minute, hour by hour, day by day. You might be surprised. The first few minutes of holding your pee, mostly discomfort. Your bladder stretches a little, like a balloon inflating slowly. It's annoying, sure, but manageable. Think of it like a car dashboard light blinking, your body's way of saying, hey, pay attention. After an hour or two, things get trickier. Your bladder stretches beyond its comfort zone, sending signals to your kidneys to slow down filtration. The tiny filtration units inside your kidneys, called nephrons, are suddenly stressed. Imagine overloading a coffee filter. It can't work efficiently when you push too much through it at once. You might not feel pain yet, but inside your kidneys are quietly straining to maintain balance. And here's a question for you. Ever wonder why sometimes after holding it too long, you feel that weird, dull ache in your back? That's your kidneys warning you. Now let's take it a step further. If this becomes a daily habit, the effects start to compound. Repeatedly holding urine can lead to tiny leaks or urinary retention, increasing your risk of infections. Your bladder, essentially a muscular balloon, begins to lose some of its tone, making it harder to empty completely. This creates a vicious cycle. Incomplete emptying causes more stretching, more strain, and a higher chance of infection. And most people don't even notice it happening until it's too late. After a few weeks of ignoring urges, your kidneys start working harder to compensate. Inflammation can begin, bladder muscles weaken, and urinary tract infections become more common. Picture overworked employees who haven't had a break in weeks. They're still trying to maintain operations, but mistakes start to happen. That nagging urge or mild discomfort you're ignoring? It's actually your body sending SOS signals. Months into the habit, things can get serious. Kidney swelling, frequent infections, and even kidney stones can develop. Stones are crystallized waste products, kind of like debris clogging a water pipe at home. The longer it sits, the harder it is to clear. Frequent retention can even cause urine to flow backward into the kidneys, a condition called vesicoretral reflux. This triggers inflammation, scarring, and can eventually lead to permanent kidney damage. At this stage, ignoring the urge isn't just uncomfortable, it's dangerous. Years of habit? Now we're talking long-term consequences. Chronic kidney disease, reduced filtration efficiency, high blood pressure, and a significantly higher risk of complications requiring medical treatment. The scariest part? Your kidneys don't complain loudly. By the time you notice something is wrong, significant damage may have already occurred. What started as a simple habit, just ignoring your body for a few minutes, can turn into a lifetime of kidney problems. And this isn't just speculation. Research backs it up. A study in the Journal of Urology found that delaying urination increases the risk of urinary tract infections by up to 50%. That's huge. Another study shows that repeated bladder stretching can cause vesicoretral reflux, letting urine flow backward into the kidneys and causing inflammation and long-term damage. Chronic urine retention also leads to oxidative stress and microinflammation in the kidneys, silently weakening their function over time. Put simply, your kidneys are quietly burning out while you go about your day. Here's an analogy you'll never forget. Holding urine is like trying to store more water in a cup than it can hold. It will overflow eventually. Your kidneys are like busy street cleaners. Block their path, and trash piles up faster than it can be cleared. Or imagine running a marathon with a backpack full of bricks. At first it's fine, but the longer you run, the heavier it gets, and eventually you injure yourself. Tiny stresses add up, and your kidneys are no exception. So what actually happens stage by stage? Short term, you feel discomfort, urgency, maybe even some cramping, and you're more likely to get a urinary tract infection. Medium term, your bladder muscles weaken. Minor kidney inflammation can occur, and kidney stones may form. Long-term chronic kidney damage, reduced filtration, and high blood pressure become real risks. And here's the kicker. These consequences are often silent. You can feel perfectly fine while your kidneys are slowly suffering. But there's hope. Your kidneys are remarkably resilient, and small changes in habits can have a huge impact. Responding to the urge to urinate maintains bladder strength and allows your kidneys to filter efficiently without extra stress. Recovery starts almost immediately. Within the first few days of emptying your bladder on time, discomfort decreases and urinary tract infections become less likely. Over a few weeks, bladder tone improves and inflammation reduces. Months down the line, kidney function stabilizes and the risk of long-term damage drops significantly. Even something as simple as not ignoring the urge for an hour or two protects your kidneys immensely. It's like giving an overworked factory a much-needed break, letting it reset and perform at its best. So could your daily habits be quietly harming your kidneys? Think about the last time you felt that sudden stabbing pain in your lower back or that nagging urge you couldn't ignore. That's not just discomfort. It's your kidneys sending a warning. Imagine if they could talk. They'd be begging for relief, for a little care, a little attention that could save them years of strain. By listening to your body, you prevent discomfort and protect your long-term health, energy, and quality of life. This isn't just about avoiding pain or infections, it's about giving your body the respect it deserves. Kidneys work tirelessly without fanfare, silently regulating your blood, removing waste, and balancing minerals and fluids. Every time you ignore the urge to urinate, you're adding stress to a delicate system. But each time you respond, you reward your kidneys, allowing them to function properly, reducing stress, and lowering your risk of serious complications. Small habits, practiced consistently, can safeguard your health for years to come. So here's a question for you. How often do you ignore the urge to pee during your day? Be honest. Think about it and leave your answer in the comments. Sharing your habits could help others reflect on theirs too. And if this video helped you understand something new about your body, take a moment to like it, subscribe for more health insights, and share it with your friends. Protecting your kidneys is something everyone should take seriously because once damage occurs, it can be difficult or even impossible to reverse completely. Remember, your kidneys don't just filter waste, they regulate blood pressure, balance fluids, and influence your energy levels. Taking a few seconds to listen to them each time they signal is an investment in a lifetime of better health. The next time you feel that urge, don't ignore it. Your kidneys will thank you for years to come.